January 3rd. So these 4 go back to the nursing home in between that time frame, and we're not sure. Comes down to same argument we had with another setting, and going back 9 months ago, that when we talked about not getting the information from state DOH, or not getting it on a dashboard, or the nursing homes not have to reporting to us. So we're going to get to the bottom of that, figure it out. But again, it was in between 4 people that passed away between December 12th and January 3rd. Again, my heart breaks for all these families. It's a difficult time. And you would hope after 10 months we'd have the system down pat. You would think that we would have the nursing homes reporting to us. And under the law, under the state DOH, private ones do not. They report to the state, but we have to talk to our county coroners too, because they should be updating us too also. So there's a little mix of everything in here, and again, people are getting tired, and people are getting fatigued, and I know that, and we got to stay strong for one another. We got to remember it's a marathon, not a sprint, and we got to work together, and we got to stay strong. We started strong, we got to finish strong, and we'll get through this by being strong and not getting complacent. As of today, there's 12,944 cases of COVID-19 to date. 272 positive cases since yesterday. Yesterday there was an increase of 257. The day before that was 163, and a dip compared to what we've been seeing because of New Year's. This now brings our 5-day rolling average of positives down to 242.8 a day. Yesterday it was 257.6. There are currently 2,898 people under mandatory quarantine. Yesterday, that number was 3,071. Of the new positive cases, 39 had close contact to a positive case. 20 are healthcare workers or residents of a group setting. 213 don't have a clear source of infection at this time. As of today, 40,803 people now have completed quarantine. Of those, 11,163 tested positive for the virus and have recovery. That's an increase of 360 recoveries since yesterday. Unfortunately, this is the number we've been watching. There were 16 new hospitalizations overnight, but now we're down to 154 people currently in hospital from the virus. Yesterday we're at 161, and that was an all-time high. And since this started, despite the numbers going down, our hospitalizations continue to go up, 8.65%, which is the highest it's been since December 4th. Unfortunately, there's still 18 patients currently in the ICU. Yesterday it was 23. I continue to urge people to wear a mask, socially distance, cough into your arm, clean your hands, stay 6 feet apart. Help us get through this, and we will. So on top of that, we really need people to stay home and, as much as possible, do the right thing. Yes, please, you can go to your local businesses. You can still order your food. You can still support the restaurants or the neighborhood stores. A lot of them have curbside pickup now. You can order. You can get delivery. So there's a variety of things you can do to continue to support these businesses here, the backbone of our community and our neighborhoods, and do it remotely and safely. So we've been getting a lot of constituents reaching out to my office about getting the vaccine. I know there's a lot of people out there that want to get the vaccine, and we're still in the 1A phase of the vaccine. This includes healthcare workers, first responders, medical roles, residents, employees of a nursing home, and long-term care facilities. During this phase, employees and managers of these facilities should also contact about getting the shot. So bear with us, we're getting through it, and we're adapting and changing. It's going to take a lot of time. As you know, Operation Warp Speed didn't work out as well, and we're adapting and we're overcoming, and we're making sure that the pods are getting set up and we're getting it out to as many people as we can. Our numbers are better than most other places of the state of getting the vaccine out, or the vaccine in arms, I should say. So, but again, we have to do better. Can't have vaccines sitting in the hospitals or sitting on the shelves, and that can be getting in people's arms to stop this infection, to get us where we need to be at 70% of people getting the shots. So Brendan Lyons wrote a good story today in the Times-Union. I think there's one in the Troy Record was a great story. So please read that, and things change, right? Everything changes, and we have to adapt to what's going on and make it work for the people. Go to Albany Med's website. They have a great website. It breaks down the phases that you would fall into, and you have to help us help you as we continue to reach out to people, adults that are 75 or older. Please contact your doctors if you have underlying health issues so you can get notified. So when that category hits, you can go and get the shot. So you have to help educate yourself too through this. If you really want the vaccine, you want to know where you fall, go to the website, go to our website, go to the state's website. It's out there. It tells you the different phases and where you fall in that category. Help us help you, please. And again, sign up to be a volunteer. That was Dr. Whalen can talk about that. It's been a huge success, and the more people, the better off we are to help get through this. So, please, everyone, read and know where you fall in the categories, and we'll get through it. So, no place has been spared, including here in Albany County, where COVID-19 has taken hundreds of Albany County residents in the span of nearly 10 months, and it's hard to believe. Yes, we've been here for almost 10 months, Dr. Whalen, you and I. Never in my wildest dreams did I think this would be continuing on at this pace. I didn't think what's going on this next month and a half was going to happen. So, again, we're working in conjunction with Albany Med, St. Peter's, and the other regional hospitals to come up with a contingency plan for hospital beds and other things. So we're trying to bring that number down to make sure that we don't end up like California, like I said before, or other areas where people are outside in parking garages or midshift tents, if we get there. And I'm hoping we don't. I'm hoping we continue to do the right thing until all the residents out there are doing the right thing. Thank you, thank you, thank you. And we're going to get through it. We just got to be positive. You got to reimagine how things are and do what's right. And the light is at the end of the tunnel, and especially with the vaccine. But Dr. Whalen.
Good morning, everyone. So let's talk about vaccine. And, we have been here for 10 months, and I sadly would have anticipated that. I thought it was going to go on this long. I think it'll go on much longer. But what I want to say is that we are at a critical juncture. And this juncture, I am happy to say, has reinvigorated my very fatigued staff. Everybody has found new energy, new focus, and a new purpose, and that is to get the vaccine out. I also read the article in the paper this morning. I will say that while that disconnect may be happening in other parts of the state, I think Albany Med and our county health department and the other participating county health departments are launching a fantastic effort. There have been daily phone calls every single day in which each entity, and you have all the local health departments, all the hospitals, and Albany Med, reports out on what they are doing, what they are planning, how many vaccines have been given out, how many new volunteers we can bring on board, and it is a continuously iterative process. I can't say how helpful these calls are to all of us, because if one person has an issue and they share how they solved that issue, it helps all the other partners. We work very well together, and I think we are going to have a great effort continue in the capital region, and I'm happy to say that the county health department is happy to be joining that effort. We have had plans for years in place, but all of us are learning real-time lessons too. Our plans were for vaccine countermeasure and were for pandemic planning. The fact that we are looking to provide vaccine to a public who has a high burden of illness certainly creates additional challenges that we're all ensuring that we're doing the best to protect those that are coming to our vaccine pods and to the staff that are providing them. There are tremendous burdens on IT, on making sure that data systems are available and up and running and at capacity to meet this need that is across the entire state. But I want to reassure the public. I think that the narrative that there's not coordination going on, I can only speak for Albany County, but I would unequivocally say that the best job that can be done is being done. And with that, I think the public has to be aware that this is a real time. real-time response. So what our goal is to be limited only by the vaccine supply that we have and to work quickly through the prioritization strategy. So we're getting, as you can imagine, our phones are ringing off the hook at the health department. We are getting thousands of calls from individuals who are asking about vaccination, who want to present their individual cases to get vaccine. I would advise people that we are mandated strictly to adhere and will be strictly adhering to the prioritization schedule. If you need to know whether you are a priority, you can visit our website or you can visit the states. I will tell you that there's a link that's up currently that says, "Are you eligible?" And if you go through it and click and become eligible, it says that it will lead you to pods, and our health department is listed. There is not a live link to this at this juncture. This is something that we are working on. Right now, for our pod planning, we are reaching out to populations and we are getting populations signing up. So as this expands, as these links become public, as we get into 1B, that is when the public will have access to the links. So I ask for patience there. People are calling and asking, well, can I get on a list for 1B in advance? And the answer to that is no. There is no database or lists that are currently being put together. As soon as that becomes available, as soon as I know more about that, I promise you I will release that information. Our goal is to get vaccine into arms as quickly as possible. This goal is shared by the medical center and all the partners of the regional hub, and I really think the efforts so far have just been outstanding. It is a very open dialogue. Everyone is working together on the challenges, and we are really heartened, and I want to congratulate the Capital District by the amount of people that are signing up. Retired doctors and nurses and other health professionals who are stepping forward and saying, how can I help? We will be back in touch with you as we look at setting these sites up. We currently have a number of our Medical Reserve Corps who we will be utilizing this week with these efforts. And as the size and scale of our efforts go up, we will need more. The medical center will need more. Our local health, public health department partners will need more. So if you have reached out and have not received an immediate response, please know that your name is there and you will likely be called upon as we scale up. January, I've been saying to all my employees, this is our Olympics. And my staff is really, as I said, energized by this. We are prepared to meet the challenge. We have a renewed vigor and are really looking forward to being part of the historic end to this very difficult time. I think it's going to be important going forward to give information about the vaccine. We are not seeing a great deal of vaccine hesitancy. We are in the populations, in the 1A population, we're estimating that about 75 to 80% of people that are eligible will be taking the vaccine, but I can't give that as a hard number because we're collecting it as we go forward. So that's good. We want a large amount of people to get the vaccine. I think particularly in light of the highly communicable variant being found in Saratoga, there's been an additional concern and an additional push for people to get information about vaccines. And again, I want to share with you that as this becomes available, I will share with you everything that I know as I know it. The vaccine is safe. The vaccine is effective, and we need to get a lot of people to take this vaccine. I think that as I indicated, we are seeing really high numbers of the ability to push vaccine out, and so far among the 18,000+ people in our region that have been vaccinated, we have not seen serious side effects, allergic reactions, etc. People that are getting it are saying it's similar to a flu shot. Sometimes there's a little bit of a sore arm with the first dose, but generally generally, I think people are doing well. My husband is a healthcare provider. He, through his work, has been vaccinated and had absolutely no side effects whatsoever. So, so I think, we can give you more information on that going forward. It is going to be very important that we get this vaccine out. And I do want to reassure the public that in our area, the collaborative efforts are ongoing. And, we are dealing with this at the local health department amidst the very high number of cases that we're continuing to case investigate. We are working very closely with our schools to assist them with testing as we anticipate guidance on that will be forthcoming very quickly, and some schools have decided to do surveillance testing or diagnostic testing for their students. So there is a lot going on. There's an awful lot going on, and we are working through multiple channels. But if I could take a moment to recognize the staff at the local health department, at the Albany County Department of Health, I would like to do so, because I will say I just never, I always loved everybody that I worked with, but I never knew how amazing each and every one of them was. And they are all rising to the challenge. Everyone is working to their best personal capacity. Everyone is all hands on deck. And we are very lucky in Albany County to have the staff that we have that continues in this very difficult effort. Thanks.
Thank you, Dr. Willem. And again, I just want to remind everyone, the light is at the end of the tunnel with a safe and effective vaccine, as Dr. Willem said, and it's critical that we join together as one community, because we can beat the virus, protect our community, and save lives if we work together as one. So actually, I might throw a question back at you, Dr. Whelan, because one of the questions we keep getting from a lot of constituents and people, if you have the COVID-19 antibodies, does that mean you can't get infected again? And I keep trying to explain to people, doesn't mean you don't have to wear a mask, because people think because they have the antibodies, they don't have to wear a mask and socially distance, and they can just socially gather.
So those are some good, that's a good question. If you have had an antibody test that indicates that you have had COVID in the past, we don't know how long that immunity will last. So we do recommend individuals that have had COVID in the past, as long as it is more than 30 days ago, that they should be vaccinated so that we get better protection for immunity. Also, it's really important that people be aware when they get the COVID vaccine, it doesn't mean you can walk out the door and stop wearing a mask, even after your second vaccine. What the vaccine does is prevent you from getting sick. It doesn't necessarily prevent you from transmitting infection if you become in contact with it. So I know that's news to a lot of people. Vaccine does protect you to a 95% level from getting sick with COVID. But until we have enough people vaccinated, we are going to continue to need to push the importance of wearing masks, of hand washing, of social distancing, of all the practices that we have continued to advocate for. It still will not be done with us, even when we start to see the vaccine rates increase. I anticipate, it'll take months to roll out to the entire public, and it will be a long time before we are living lives without masks.
Thank you, and just wanted to clarify that, because I continue to get that question, and we continue to try to put it out there, so thank you. So just switch gears. I announced the amendment to the emergency order capping the third-party delivery fees at 15%, and that amendment version also capped marketing and other fees at 5% where they're making their money. So a little bit of good news. Yesterday, we're notified by 4 local restaurants that Grubhub had announced they would not be adding and abiding by the caps that we put in place. And actually, in one case, Jason, thank you for the heads up, they refunded fees to that restaurant, so which is nice. Again, showing support for local restaurants and making sure that we keep them in business as we continue to move forward. And I also just want to say one of the other issues we had on here, we've been fighting since, I think, 2014 with bomb trains and other trains in the Port of Albany and throughout this nation, was the positive train control. And it was finally implemented. 2 weeks early, so I want to thank Eric Anderson for his article in the Times Union today, because it spells it out. But the federal, this was announced by the Federal Railroad Administration. It was finished 2 days ago before the deadline Congress mandated at the end of 2020. It took a long time for us to get there, but it's been a very we've been very vocal about this and the importance of positive train control for many years. The PTC is intended to prevent trains from running through red signals and being switched to the wrong track. So again, this covers over 57,000 miles of railroad track. So thank you for getting that done. Takes a while, but I just thought I would share that because it is a great story and a conclusion to a battle we've had here since 2014 and have not forgotten. Also to Senator Schumer for his being elected to the leader's position in the Senate. So congratulations to him, and I look forward to working with him and the wonderful things he's going to do here for the state of New York. Please, if you need to get tested, go to the Whitney Young, 518-465-4771. We cover it if you don't have insurance. Also, Albany set up many sites throughout the state through the governor's office. No insurance needed, no co-pays. That number is 1-888-364-3065. And again, go to the albanycounty.com website. You can see the places where you can get tested, age requirements for different kids, rapid tests, wait times, all that stuff. Please go on there and know where you want to be or where the best location is for you to get to. Also, mental health. I'm going to probably talk to Dr. G about coming in to talk about it. I talked to you last week about some of the people being really, screaming at the people that are trying to help them, and that's not what they're there for. They're there to help you, to get the help that you need. And if you look around you, people are getting more tense, and people are getting more agitated, because, again, as Dr. Whalen and I have said, this has been 10 months. It's been a long 10 months, but we got to finish strong, and we have to finish together. And I know it's difficult. Trust me, I know. I know people want to see their loved ones in nursing homes. I know they want to be with their family. I know they want to just travel. But if we hang in there together, we'll get through this. We're there, like Dr. Whalen said. It has energized so many people. But just think about the men and women that have to go out there every day, regardless of whatever their job is, to keep our society moving. Think of CDTA bus drivers. The men and women that have to drive them buses to get people to work, get them home, get them to the doctor's appointments, get them around. There's people in every field that are working so hard for the people of Albany County and the Capital District. Please think about them and to the families that lost people. We can get through this. We can get through this working together, staying calm, and trying to figure this out together. And as Dr. Whalen said, we've learned a lot of lessons these last 10 months, and the things we did right, the things we didn't do right, and the things we need to do better. But we all need one thing: partnerships. And no finger pointing, working together, finding a solution to the issue, being part of the issue, not being the person that's causing more problems. Be positive about how we approach this and how your answers are. But again, please do the right thing out there. Our 24-hour sexual assault hotline number, 518-447-7716. Our great partnership with United Way with Pete Gannon at 211. And the New York State hotline at 1-888-364-3065. Please stay safe out there. Wear your mask. Cough in your arm. Clean your hands. Stay 6 feet apart. Any questions?
Just have 2 questions. First, I wanted just to be clear. It sounds like from Dr. Whalen, what you were saying is that from the health department and Albany Med standpoint, you have a well-oiled machine and you're in clear communication and guidance with each other. When it comes to the state, from what I'm hearing from other supervisors and other county leaders, it seems like they're not receiving clear guidance and communications. And when the governor makes an announcement, when we learn about something is when you learn about something. Can you talk about that, as well as anything that they could do to better help you in terms of getting through these phases and getting the vaccine out?
Sure. So I would just like to amend what you just said by saying we are developing a well-oiled machine. It is something that is a continuous, iterative process. We are all learning every day, and every day there's some new way to improve. But I do think the collaboration there, and I think that's the most important ingredient. In terms of the state in particular, yes, it is true that often we do not hear of guidance until this is spoken about at press conferences. That's true. That's the way it's been. And I think that there is a tremendous need for both the state and local health departments and all partners to be nimble with this. It is what has occurred since the beginning, so we have adapted, and we are working quickly to make sure that we are on board with every new bit of guidance that comes out. I think that in an ideal world, yes, it would be very helpful to know about this in advance and to be able to get all our ducks in the row so that we are able to answer questions and able to anticipate concerns before we're aware of things. But having said that, I'm also aware of the very real fact that this is real-time response. And with real-time response, there has to be a balance of, is there a need to wait on messaging information to the public? And, we also have as one of our core values to be transparent and accountable. So there's that balance. And I understand with the need of transparency that often the wish is to get the message out to the public. And we are being as nimble as we can when we receive that message, and it does entail guidance or changes in policy that we have to enact, that we can do that very quickly.
It seems like there's maybe an eagerness from the public to get the vaccine, so that could be a part of why there's kind of this ethos that it's a slow rollout. Are you able to explain how long it's going to take to get through these phases and get to people, or is that back to my original question of guidance from the governor and you just not having a clear idea right now?
Oh, I don't think that's anything in terms of information we're not getting. I think that is something that, is going to be very highly dependent on a lot of things. So what we're talking about right now is hopefully the rate limiting step being the amount of vaccine. And but while we are talking about that, we're talking about the need to build tremendous capacity. So while previously, it was going to be a gigantic effort for us to stand up a pod, which is what we planned for, we're now looking at how we all coordinate multiple pods, multiple vaccine efforts, getting it out through every single channel positive. So I think what's happening now is that the plans are being put in place for that larger rollout. So that includes getting vaccine to doctors' offices, getting vaccine to hospitals are already utilizing it, but to our pharmacists and to other partners, and looking at innovative ways to get vaccine out to high-risk populations. And this is going to be a massive coordination with state and local partners, and it does take time. So all of that is in the works. And once we start to know more about the vaccine that we can anticipate, then we can better inform a timeline. But at this point, we are still focused on 1A. There are quite a lot of people around the Capital District that meet the criteria for 1A, and the vaccine effort, I think as soon as it can be switched over, because we know our essential workers and our individuals that are at high risk over the age of 75 are a huge focus. And we want to be able to get those vaccines out. Those individuals are essential to operations of day-to-day life in our county and throughout the state. All of you are important, and all of you, will be vaccinated, and hopefully we can get this out sooner rather than later. But it's capacity, and it is the planning that is currently under the microscope and being evaluated on a daily basis so that we can continue to grow and expand to meet this challenge.
Just one follow-up. You might have already answered this, but when it comes to 1A, is there a timetable of getting out of it? Or because the governor's already talking about 1B.
So I don't know what the timetable is. I don't know that yet.
Going off of Lewis, with that 1B, will the counties all move together? Is it like a regional move through the phases, or is it dependent on each county and how far into each phase they make it?
Well, again, that guidance will come from the governor's office. I imagine it will be phase 1B will hit us all at the same time, but I can't speak to that with uh, I can't be definitive about that.
Also, you've mentioned getting a lot of volunteers already. Do you need more, and do you have a number for how many you've already received and then how many you might still need?
So we will need more, and I would encourage people that are still available to do that, to sign up. And I know, I haven't received the numbers for yesterday, but I know on December 31st in Albany County we got 81 new volunteers. So we're starting to see a large number of people turn out, and that's great. So, when we're talking about really large volumes of volunteers, one of the challenges for us is who is going to mentor them and train them. So you have to have an administrative level to meet that. We are not challenged with that yet, but it is a challenge that I would anticipate going forward and scaling up, because everyone needs, for our county health department pods, everyone gets just-in-time training. Everyone, gets a walkthrough of how the operation is working. It is time-intensive. It is easy to adapt health professionals because they have the expertise and they are usually ready to hit the ground running. But going forward, there will be the need for that oversight that we want to ensure is in place.
With the pods, and you kind of touched on this before, how many do you currently have in the county, and then how many are you looking to expand to once the rollout becomes more widespread? And will it be a site that's similar to a testing site, a pop-up tent, or will it be a doctor's office and a pharmacy?
So pods are generally large-scale vaccine efforts, so it would not include something like a doctor's office. It would be a larger space where we could move people through pretty quickly. We are standing up our first pod this week for 1A and look to increase our numbers next week. In terms of how rapidly we will expand and the numbers that we are looking at, this is something that was discussed this morning on the regional hub. I'm circling back with the team. We have to have a frank discussion on what it's going to take. And, in addition to volunteers, in addition to oversight, it's other practical considerations like IT. Do we have enough computers? Do we have enough, there's many practical things that go into this. So there's a lot of considerations. We want to ramp up to the optimum capacity. That's the bottom line, and we'll be looking to do that very quickly.
Concerning 1B and extremely vague guidance from the state, I don't know if you heard the governor's briefing yesterday, but he mentioned first responders essentially vaccinating themselves with existing infrastructure, and specifically called out the Albany Police Department because of its size, saying that they should have the resources to do that themselves. Is that the first that you heard of it yesterday? And is that a practical way for first responders to be vaccinated if it's just sort of a cross-pollination type deal? Because he didn't really give any details.
Right. So, these are the kind of innovative approaches that we're discussing on a daily basis. There has been discussion and there is training that has been developed for EMTs to become vaccinators. So as that rolls out in our region, it may make sense for EMTs to vaccinate those in the law enforcement and other communities. It depends on every area's infrastructure. So while we look at these broad-based recommendations, we also look at what the infrastructure in the region is. So we know in Albany County, Regional Emergency Management has physician oversight. They likely, and I won't speak for them, but I believe the infrastructure is in place, and I believe there is a desire in place to be able to do that. So I think that's a good idea. But there are many different partnerships that we are looking at and talking about in terms of how to get vaccine out. So, currently we're looking at home care as part of 1A. Does it make sense to train individuals that are doing home care to be able to go and vaccinate the high needs people that they serve? Does it make sense for school nurses to vaccinate their teachers? Does it make sense? There are all these discussions, and I'm not saying that these are guidances. I'm saying these are all the considerations. If you start to look at ways that you can get vaccine out as many ways as possible, it is normal to start thinking things this way. And where the oversight and expertise and where it makes sense, it is important that we immediately become aware of those potential partnerships, and to the extent possible, they will be utilized. So, some of that will come from clear guidance, and some of that will come from organic relationships that we have developed in Albany County with our many community partners over the years. So it'll likely be a blend. But again, I can't use the term all hands on deck enough to say how important it will be that we utilize these collaborations every way we know how.
The governor's stated purpose behind that directive was to minimize the burden on the actual healthcare system and the people who've been working over the past 10 months. So is that, if the first responders are sort of a self-sufficient group, does that actually make a significant difference in minimizing the burden based on the number of first responders we have, or is that more of a drop in the bucket? Would they, I guess the question is, would they actually be burdening the system if police had to use the same channels as the average person to be vaccinated?
So again, police and law enforcement fall into 1B right now, which is also a group that a great majority of the population will fit into. I think that, again, the question of how these vaccines are handed out, it's not a value judgment. It is how can vaccine be put into arms as quickly as possible. So certainly the police are essential, as are individuals that are working in our grocery stores, as are teachers, as are many other workers that are going out every single day in the face of concern and risk. So I'm not, by talking about potential collaborations, making any kind of value judgment. I'm just saying that when there is a system in place that can be utilized, it will be utilized.
Just a quick question about the UK strain of the virus. It's my understanding when you take a COVID test, it just says that you're positive or negative. It doesn't tell you which strain. How is the county making sure and seeing if the strain is here in the county right now?
That's a great question. So, as you know, there was a case that was isolated in Saratoga County, and we had been aware that since the end of December, Wadsworth was doing testing. Now, are they doing testing on every single positive COVID case in the county? The answer is no. They were taking random samples and looking to see if they could identify it, and this was the first case that was identified. So I believe Saratoga County has set up pods that are starting to look at individuals that may have been in contact with that establishment or that individual, and they are likely going to take up positives from those cases and start that process to determine whether there are others that are infected with this strain at the same time that they continue to do this kind of surveillance type testing. So I imagine, from what I know, and I wasn't involved in the case investigation as it was in Albany County, I read in the press this individual did not have a travel history, so that tells me that there likely is more of it in our region, and I wouldn't be surprised if we start seeing more cases, but there are definitely efforts underway to determine if there are more. And just, as a matter of education to the public, we can't genetics sequence every single positive case because it is a very time and laboratory intensive process. It is completely different process than just a regular either a PCR or a rapid test.
Just in a practical sense, what is the value of identifying the new strain if there is no separate set of guidance for the new strain compared to the previous one, and the vaccine already works for both strains? Are we wasting resources by trying to identify this if all of the procedures, the quarantines are the same?
Well, I think you're looking at it from an individual perspective, and we look at it from a population perspective. So if you have a strain that is 70% more communicable, what does that tell you? That tells you that a lot more people will become infected. So yes, from your perspective, it's important for people. It may reinforce guidelines. People may say, oh, gee, now maybe I better put on a mask if I haven't before. Now maybe I really better start paying better attention. So from an individual perspective, I expect that people would renew concern. From a population perspective, it means a lot to our hospitals. This is, if we are seeing a strain that's that much more communicable, even though there are not, that has not been shown to be more serious, more people will become infected. And if more people become infected, more people will be sick, more people will need to be hospitalized, and more people will die. So in a community, it's very important in terms of a predictive value for our hospitals. And currently in a situation where we know our hospital system is starting to see a little bit of capacity strain, it's incredibly important for us to know about this.
And on schools, on Monday, the governor said that if you're over 9% in an area, but the schools are testing at beneath what the community is testing at, the schools can stay open. Do we have any idea what the deal is as it relates to the schools in this area, whether they're testing above or below where the community is?
So that's important information that went out. Our schools, and in fact the local health department had previously been given guidance that schools were not to test unless they were in a microcluster zone, and we have not been given a microcluster designation at this point. Some of the schools have proactively started testing, but we anticipate that guidance will be forthcoming on this, and we are working very closely to make sure that our schools are ramped up to begin testing. And in fact, I can tell you we reached out to all of them yesterday. There is a training that is being provided for all the schools today on the computer-based system. They already have training on the provision of tests. Many of them have a supply of test kits that they had previously put in place to begin this strategic testing. Some schools have decided to start doing testing of 20% of their populations. I think it's a good policy. I think it is good guidance.
So based on what we know now, schools shouldn't open, and they should probably do what the county executive said on Monday of 1 week remote just to get into the swing of testing, I assume.
So again, the schools were prepared to get into the swing of testing before we went on the Christmas break. The decision around testing is to determine, what their positivity rate is vis-a-vis our positivity rate. So that will be an important piece of information. But there has not yet, this doesn't necessarily mean that schools should close before they get that information.
Thank you, everyone. Be safe out there.